Hello everyone. Well, who's ever on and following this evening. I put out a little video recently, but I don't think that it really got out there and got through properly, and I'm beginning to wonder why. First of all, I want to promote my friend Ty Bollinger tonight. He's out there on the truth about cancer, that cancer does not have to be a death sentence. Tonight's episode, his first episode, will be, I think it's on the history of chemotherapy and the doctors that have lost their lives. Not giving it, lost practice, lost things, lost everything. If you find Ty Bollinger or Truth About Cancer on Facebook, I urge you to go find that, click to it, get to it. It starts tonight at 9 o'clock. Really great interviews. His first one he did a couple of years ago was excellent. There was so many series that he did. Last year he did another one a little bit. He went to a couple different countries around this countries, added a little bit from last year to this year. Just he keeps going, and he is he's definitely, and I say it all the time, but he is definitely my hero without a doubt. He keeps knocking on that door and he's pissing people off the way he needs to be, and God bless him. God bless him, his wife, his kids. They put a lot at risk and on the line to come up with the information that he's doing out there and getting his hands on and to spread. So anyway, there is a little story that I wanted to bring up tonight about a recent patient, and his story is enough to really get you, and I wanted to share it quickly. The man is in his 50s, or early 50s, and not too long ago he had surgery on his esophageal area because he thought that he had something. Everything was fine. He's been doing fine ever since, recovered and so forth. But this past year he felt a little something, and they went back to the doctor. They did a biopsy. Sure enough, they find he's got esophageal cancer. He elected, they got him, they told him right away, it has to be right away, it's aggressive, which is, they tell everybody that all the time. He decided to do some radiation and chemotherapy, and he's doing that right now. But they said that they're gonna biopsy again and double check, and they'll get back to him while he's doing his treatment. So he's doing treatment. He was going to do some stuff with us. He never got back to us. And again, we don't heal anybody. We don't claim to heal anybody. We don't treat cancer. We help people get their immune systems up to fight cancer, to build up strength and immunity in the system, because we believe the body's capable of fighting many things, including cancer and other diseases, and getting well. So this gentleman got in touch with us, and we got into talking with him, and he's telling us this story. And as I think he's like 3/4 of the way done with chemo and radiation, I think he's got like 2 weeks left, somewhere around there. And then they told him he was going to take a 5-week break, and they get back to him about surgery, because they get to him the other night, and they turn around and tell him, oh, we were wrong, and it's worse than we thought, and out of the two, one's not so bad, the other one's bad, you have the one that's so bad. And we're thinking that after calming you down from chemo and radiation, we want to do surgery on your neck, because we think, this is key, we think that there's a tumor there, and we think the rest of the cancer is gone, but there's a tumor that we have to go get. And I'm like, okay. And he says, so I said to him, I says, where's the PET scan or the CAT scan or the MRI showing the lump in your throat that they want to go get? Because they're saying that there's maybe a 3 to 5% chance that he makes it, if he does it, if it's there. And if they get it, he's going to be eating through a tube for the rest of his life, and he's going to have to sit up in bed forever to go to bed. And I said, there's no MRI, there's no PET scan, there's no CAT scan of the throat showing this tumor, but yet they want to cut your neck open. I suggest you go for a second opinion. He went for a second opinion, and they did the same thing to him. I said, do these doctors know each other by any chance? I says, it just seems very weird that a doctor wouldn't go in and see that he has that with either an MRI or a PET or a CAT scan, something, to see a tumor, to go after it, to want to make such a life-changing situation for this man, or maybe not even make it out. He sounds good, he looks good, he feels okay. So we do certain things at our office, and we refer out for other things because we used to do IVs. My MD had passed away, and we're trying to find another MD to replace him to get back to doing IVs again. But, some things that are out there, and these are the things that Ty Bollinger has talked about, things that I've known over the years and helped people with. High-dose vitamin C is something that I spoke to him about and educated him on. There's B17 that's out there that he can go look at. There's IPT therapy, which is insulin potentiated therapy. There are therapies that you can do together. There's hydrogen peroxide. There's chelations he's going to have to do. There's diet we spoke about, which we're getting him to do, and supplements and essential oils and things that we put to patients. So he's going to be doing certain things with us, and other things I'm going to turn him on to that he can go elsewhere and go get. And in certain states, other things that he needs to get that are legal for him to do that other people that are doing there and beating their cancer. And we're turning him on to that. So he's electing not to do surgery. And in 5 weeks that he's going to wait, he is going to wait 8 weeks instead. He's going to come here for 2 months. He's going to get on my pulse electromagnetic frequency. He's going to cleanse and detox with my far infrared sauna and the ionic foot baths. We're going to do nutrition with him. We're going to show him how to properly juice, whether with the Norwalk or with an Omega 8006, either one. We have both. We're going to show him how to juice properly, how to do organic coffee enemas properly. We're going to teach him about no sugar and no dairy and no breads and no white flours and antioxidants and good clean supplementation and things like chlorella, spirulina, and all these other moringa, all these different superfoods, green foods, and things like this that his cells need to help build his immune system and fight his cancer. But it's ironic, folks, that I hear the stories, and to tell you the truth, I know you hear this all the time, but if I literally had $1 for every time I've heard it's an emergency, you got to do it right away, we can't wait, and that it's a rare cancer and it's aggressive, I'd have a couple of dollars. I would not be rich, but I'd have some nice money. I'd probably pay my mortgage, without a doubt. It's insane. It just seems to be very systematic. It seems to be this is the way that it is, and this is the way it got to go. We're all indoctrinated into it. We're born and told you get cancer, we either cut, burn, or medicate, and that's not working. Okay, and I explained this to this guy. I mean, if you go to the American Cancer Society, they tell you that 1 out of 3 women and 1 out of 2 men in this lifetime are going to come down with some form of cancer, and people aren't getting it. If the treatments and the chemo and everything was working, the numbers would not be increasing; they'd be decreasing. Do the math. When they tell you they don't have something for you, then you try something else. If it might, and God bless my brother-in-law, it's tough for him. He's having a rough time, but my wife is doing really well, and we don't take it for granted that we beat it, we own it. Of course not. It's cancer. It's smart. But when you can teach yourself, stop feeding it, how to choke it, what not to put in your body that it doesn't need to feed it, and start learning how to kill these cells and what antioxidants to use and what oils to use and what herbs to use and how to juice and how to green smoothie. And let's get it straight, folks. Green smoothies, blending for Vitamix, and juicing is 2 different things. Please understand that. And I know that you spend the money on the Vitamix, but yes, you're going to need that anyway. But you are going to need a juicer. And the difference between the two is that when you blend, you're getting fiber. You're getting some greens. It's great for the bowel. It's great for the liver. It's good for your cells. Your cells are going to get this. But when you're diseased like cancer or you have autoimmune diseases and blood disorders, you need to be juicing because you want the enzyme. And the reason why you want to get like an Omega 8006 or other models that crunch, break it down, and have like an ogre in there that crushes and masticates, because you can put your leafy greens in there and you get juice from it. You can't do it with the spinners. You can't do the greens in there because it doesn't work. And when you juice with that, the heat from the spinning is killing off the enzymes you need for juicing. If you're a beginner and you don't juice and you just want to juice, those juices are okay. It gets you in the game. You're going to feel it. But if you're diseased, don't go near those. Those aren't it. You want the masticated ones that break down all your leafy greens and so forth. So it's just another story that I wanted to share with you. It's got to stop. This man is making a very bold choice of he's going to finish. He's got 2 weeks left of his chemo and radiation. He's not going to do this no more. And he's ready to go nutrition. He does not want surgery. He does not want to live with a tube. He does not want to sleep up for the rest of his life. He does not want to lose his voice. He does not want a feeding tube for the rest of his life. He does not want to take the chance of maybe 5% not making it. He's taking a very bold stand with some knowledge and getting educated about what are my options. This is what Ty Bollinger is spreading around the world. Cancer does not have to be a death sentence. You got to not be scared. You got to take that leap, and it's not easy. It's hard. Okay, it's taking that leap to believe, can I do this? Can I be diligent? Can I do the juicing and the smoothies and the enemas and the supplements and the treatments and the things and the saunas and the pulse electromagnetic, the PEMF that we got, the pulse unit now. I have a pulse center now, part of my clinic. I've done PEMF for so many years, and now we graduated to a stronger pulse that's 5 times stronger than that now. And the stories are endless in what we're doing with this for people. But you got to take this leap. You got to trust what God has created. And you got to go with it. And it's tough. It's a personal decision. But you know what? Folks like me, Ty, other physicians, chiropractors, naturopaths, homeopaths, MDs, are all trying these alternatives and helping people survive and teaching them that cancer does not have to be a death sentence. Stories like this man is insane. And they're a dime a dozen. It's getting out of hand. Start educating your folks. Start educating your folks, your family, your friends, your loved ones, and start digging deeper. Just don't take my word for these things. Look up these things we talk about. So this is another short video from JAS Medical and Wellness. My name is Dr. Scott Perlman. I'm here in Marietta, Georgia, and just sharing the information. This is a cancer story from Marietta, and from my hearts to your hearts. It's important to me, folks, that it's important to you. Thank you so much, and have a blessed evening. Bye-bye.